I'm Dr. Melinda Tavernier, and I'm the Executive Director of Coastal Samaritan Counseling Center. What I've noticed over the past year that I've worked with people in our community is there's a need for mental health that's continuing after maybe a crisis or something along that line. Breaking Barriers offers us the opportunity to go in and provide those services at no cost to the uninsured or underinsured, and they can have the continuation of mental health services after they've come out of a crisis situation, and they can work thoroughly through it without having to stop their services because they may not have insurance, they may not be able to afford even the copay.
My name is Bethany Noss. I work as an LPCA at Coastal Samaritan Counseling Center. One of the most powerful things I've seen working with these clients is a lot of them really have just not had the kind of support that a lot of other clients have. They don't have the social support, they don't have the clinical mental health kinds of support. And so a lot of these clients come in with pretty significant trauma histories that they have never dealt with, never been able to talk to anyone about. So just being able to work with these clients and see them process through things that they've never been able to talk about before, have a safe space to do that, and then come out the other side stronger and with decreased symptoms, decreased, anxiety, PTSD stuff, it's really incredible.
My name is Stu. I'm one of the counselors here at Coastal Samaritan. I do clinical mental health counseling, and I also do substance abuse. I've been able to work with clients who have benefited from having this program and have shown improvements and have improvements from this particular Breaking Barrier grant.
Roberta Vogel, and I am a supervisor at the center. I was the clinical director for 10 years and was involved when Breaking Barriers first got started. I think it's been a great way for us to reach out into the community in ways that we wouldn't be able to if we didn't have the support of United Way and that desire to grow our counselors at the same time. And that's been the mission of the center, was to reach the people that would not normally be able to get counseling.
Amy Wendelowski. I am an LPC. I am an alcohol addiction counselor. I was able to work with a very diverse group of guys at a sober living facility in Ainer, South Carolina was where that was. And in my working with them, it really developed me into a counselor, because this is before I was a licensed counselor. So it helped get me to where I am today now on the grant.
Hi, my name is Elizabeth Sierra. I am the practice manager for the Center for Counseling and Wellness. My role here is I speak Spanish. I'm the only one that speaks Spanish here. So when clients come in, we want to serve the entire community.
Hi, my name's Becca. I'm a counseling intern here for Breaking Barriers, and I'm currently serving at the J. Rubin Long Detention Center and Friendship Medical Center in Conway. It's been a great experience meeting people sometimes at their lowest, and just seeing the weight get lifted off their shoulders sometimes, that someone shows up for them week in and week out and shows care and help in getting their mental health kind of stabilized.
My name is Kelly McCall. I'm an LPCA. Breaking Barriers has been so awesome. We've gotten tons of people referred to me. I refer people out all the time, people that I know. A lot of people, I think, in this area struggle with getting access to mental health services or just being uninsured or underinsured. So I always make sure to let people know that we offer this service.